Hello everybody, this is Mark with US Benefit Alliance. In this video, we're going to do an overview of what the OptiMed Gap Supplemental Gap program is for group medical plans. So for those of you that are in the group health insurance arena, you definitely want to check this out. I consider it the best gap product in the business. And with that, I'm going to go ahead and introduce you to Rob Devitt with OptiMed, and we'll get started. Hi, Rob.
Hello, Mark. Well, thank you all for having me today. It's a great pleasure to be here. So as Mark mentioned, I'm Rob Devitt, one of the vice presidents here at OptiMed Health Plans. And today, what we'll be doing is a deep dive into gap supplemental products for the group health market. We'll talk about the nuts and bolts of the products, what fits best as far as clientele, market segments, industries, and we're looking forward to it. And really looking forward to working with US Benefits Alliance here at OptiMed. They'll be one of our managing general agents for gap plans and other products that we offer. So as mentioned, we are very excited to work with US Benefits Alliance here at OptiMed. So we'll start with a little bit of background about OptiMed and who we are. At our core, we are a third-party administrator, full service. We've been doing this for 60 years, as you can see. And by full service, we are taking care of the claims, administration, billing, customer service, and all for you and your clients. Since we've been doing this for so long, we know what it takes as far as handling our clients the right way the first time, and they trust us with that business. We are not one of the BUCAs. We are not a major medical health carrier, right? So in order to be successful the way we have been for so long, we've had to take the service aspect very seriously and take care of our clients. And the partners that we have, as far as the carriers, they're all A- excellent or better. They have come to us because of the way that we market and administrate the plans, and they trust us that way. And that's why so many different agencies, consultants, and clients out there have trusted us for so long to work with them. So what you'll see here is the states that we operate in as far as our gap supplemental insurance. You will see some states that we do not operate in for the gap plans. Those include New York, New Jersey, Connecticut, New Hampshire, Minnesota, Montana, the state of Washington, and then Alaska and Hawaii. But you will see on the map that you're looking at a majority of the United States that we can operate in. I will say there is, as far as participation and eligibility requirements, they are different state by state. So should you have questions for a specific client, please reach out to me or to the US Benefits Alliance team, and then we will be able to answer the specific question. As again, it does differ state by state as far as eligibility and requirements. So gap plans, what are gap plans? They are a tool to help cover the members' out-of-pocket expenses for the major medical plan. Gap is a fully insured first dollar benefit. You are coming to help cover eligible expenses on that HDHP in relation to deductibles, coinsurance, and copays. You are giving the employer a greater freedom in selecting that lower cost, high deductible plan. You know, as we see so much in this market today, almost everybody is moving towards those deductibles that are $5,000 and $6,000 deductibles. And the out-of-pockets can be much larger as well, ranging up to that $8,150. And those are scary numbers. That the premiums are cheap, but if something catastrophic happens, your deductible is $5,000 or $6,000. What you see as far as the healthcare market right now and the members is sometimes people will avoid going to get help as far as the emergency room or an urgent care visit because they're so scared of the bill they might face because their employer has them on that high deductible health plan. So what GAP comes in to do is to help cover those eligible expenses, soften the blow on the members' out-of-pocket expenses, and to also cap the employer cost as well. We do not see GAP as a burden on our clients. We see it as a problem solver. right? It has to make sense as far as going from a low deductible to a higher deductible plan and having the gap filled in first dollar fully insured. So some highlights and features on the gap plan. You can have gap as a voluntary or employer paid plan. You have the option between the two. And of course, the contributions can vary as well, as far as maybe 50% or 75%. You will see some fluctuation in the pricing, but not too much, not too drastic. But again, it's not one size fits all. You can have it multiple ways and multiple options. So to be eligible for this, of course, you have to be on the group-sponsored major medical plan design. You may not be on your spouse's plan or a different plan design and then join this gap plan. This gap plan, the policy is based off of the major medical policy. So that's how we follow as far as our guidelines, with some different exclusions that we can dive into later on in the presentation. You'll see here that, of course, it has to be a valid ACA group health plan as well. No 1099 employees. You must be a W-2 working 30 hours or more per week. So again, one size does not need to fit all. There's multiple variations of our plans and how they can operate. So for these plans, you'll see that we go as low as 5 enrolled or 10% of the eligible population, whichever is greater. So the market segment we tend to see, of course, the minimum is 5 enrolled, and we would go up to about 450. That's the market segment we have seen, and the sweet spot in there would be 5 to about 150. That's where we see most of our clientele fall in that range. Of course, do we have those larger clients? Absolutely. But again, 5 to about 150 is the sweet spot for us. Now, the gap plans themselves, of course, they're covering inpatient and outpatient expenses, as they pertain to the deductible, co-insurance, and copay. So we use a 2-card system for the gap plan. 2 cards, you hand in your major medical card, and then you have an OptiMed gap card. It's a hard plastic card that you would hand in to the provider at the time of service. Now, benefits are assignable. So what's happening is, to qualify for this, of course, this specific condition, it must be covered under the major medical as well as the gap plan, as we pay off the primary EOB for determining what exactly is covered. So when you hand in your secondary card, this gap insurance ID card, what's happening is the provider is filing these directly to OptiMed. As a TPA, we are paying those claims for eligible expenses, of course. That is the way our gap plans work. We've seen phenomenal success with a 2-card system. You'll see at times other variations of gap plans or true gap plans. Some will have to where you have to file for reimbursement for every single occurrence or every single time that you utilize the gap plan. We found it so much more successful to have a 2-card system in place so that you do not have the members or the HR representative for the client always filing for reimbursement. Now, what you can do is you are also able to file for reimbursement if you would like to on the gap plan. It's a very simple process if you would like to do this, or if the provider, if something happens as far as filing the claims. Mistakes might happen sometimes. So what will happen is you will get your EOB for the major medical plan, and then you can go to our website in our claims portal, and you can complete that claim form and then file for reimbursement so that we will take care of that for you. There's multiple avenues, of course, to submit for reimbursement or to have claims paid. So again, just like our gap plans are voluntary or employer paid and have different kind of benefit variations, one size does not need to fit all. There are multiple avenues to go as far as taking care of the client and the members for their claims processes.
So Rob, if I could add in, as an insurance agent selling group health insurance for over 20 years now, we've seen some gap products that's come and gone. And one of the biggest hurdles we always ran into would be the insurance company is sponsoring the gap product, And the employee is always left trying to adjudicate the claim, to turn in the claims forms and stuff like that. And employers are really sensitive about that. They really don't want the disruption. And this is one of the key things with toOptimed that really gets me excited as an agent and as an MGA for you, because with the two-card system, you're really, as a third-party administrator, you're taking that anxiety and all of that heavy lifting off the employer and the employee's shoulders, so they can do what they do best, and you do what you do best in adjudicating the claims.
Absolutely. And, you know, that's a problem that is out there so much, because your clients, of course, they do not want a lot of hassle with, of course, bringing in a new type of product and then to have issues on claims. That's just an administration nightmare that no one wants to face. No one wants to have that in-house. You want it to be a smooth process, especially when introducing a different type of product, just like this GAP plan is, Mark. And we've found that the two-card system, like I mentioned, it works so well. And of course, if we could have some testimonials of our clients that would rave on and on about how the two-card system saves them a ton of hassle. I mean, we have a ton. And to keep in mind as well, even if something does happen, let's say if the provider does not file it correctly, maybe they've never seen a GAP plan in place in the secondary insurance, well, that's okay. Like I mentioned, the member or the HR for the group, they would be able to go get the EOB for the member and then complete a claim form on our website to solve that problem. And it's all electronic as well, so you can go to your computer and take care of all of those issues. So what we'll dive into now is, with our GAP plans, you will see a list of non-insurance benefits that come with no additional cost. So you see some pretty big benefits here. We'll start with the most important during these unprecedented times would be telephonic doctor visits. It is through the vendor iSelectMD. There is no copay for using our telephonic program if you have the GAP plan in place. There's no copay whatsoever, no cost for it. If you would like to call one time per week, you may do so. There is no copay, and it's great. You are able to get a doctor on the phone. So let's say, if you had a rash, for example, you're not sure if it's poison ivy, use your telephonic medicine program, get a doctor on the phone, and they will be able to help you out. If it's poison ivy, go to this pharmacy for a prescription. Or if it's not, if it's just a rash, then you save the time you might have had if you had gone to the doctor's office, scheduled an appointment, sat there for a little longer than you intended while taking off of work as well. So it saves the hassle, saves the trouble with telephonic. Of course, also we have the patient advocacy program, a wellness nurse line, an EAP, employee assistance program. toOptimed, we also have the Section 125, and we have the COBRA administration that we do in-house as well for all of our clients, that of course they would have this GAP plan in place for them. Again, non-insurance benefits that come with no additional cost for utilizing the services, no copays. There's no limitation on how many times you can utilize the wellness nurse line or the employee assistance program. So,
All right.
Mark, of course, for U.S. Benefits Alliance, you'll see here, and I'll let you take it from here as far as learning more or contacting you all for any questions.
Yeah, thank you, Rob. So before we wrap this up, do you have any final thoughts or anything that you think we may have missed that you think we should touch on right now before we wrap up?
Well, one thing I would like to add, I guess, as a final thoughts for everybody that would be listening to this, would be that, again, GAP, a fully insured first dollar benefit that, of course, you are covering your inpatient and outpatient eligible expenses. So these plans are fantastic, as in this ever-changing market, sometimes you have to get creative as far as providing solutions for your clients. Maybe you get stuck with a massive increase. One year, the group had a bad year as far as claims, and you're trying to figure out how to combat an increase of 30%. or if the owner or the CFO or somebody for the group itself, they're looking for different solutions just as a whole. This is a great product to keep your clients happy. And it is also, I see, as a foot in the door kind of product. It is outside of the box, and it gets you that foot in the door if you're looking to prospect or help someone that you've been trying to help out for quite some time. And we're very excited to work with you all, again, at U.S. Benefits Alliance, Mark.
Okay, thank you, Rob. So 2 last points. If you are an agent looking to learn more or to get contracted with this OptiMed GAP product, please give us a call at the 800 number shown there, or send us a request at quotes@usbenefitsalliance.com, and certainly visit our website to learn more about us at www.usbenefitsalliance.com. And last of all, I'd like to mention on our website, we do have what we call an agency builder program. It's a suite of videos and instructional pieces that are very helpful to the agent. If you're an agent that contracts with us, or even an agent that's just wanting to learn more, if you want to get in and get some great product training, definitely we can pass on a login information to you for you to be able to have access to this product overview we just did today. And the upcoming video will be posting in a few short days after we post this one, where Rob will be giving us a very, very deep dive on this GAP product. So you'll have all the ABCs on the product, all the details, and of course, you have your support here at U.S. Benefit Alliance as your MGA for this product. Rob, thanks a million. I appreciate it, and I look forward to our next training video with the deeper dive on this product, and then some of the other products that OptiMed offers as well.
Absolutely. Mark, thank you all for having me, and look forward to doing a ton of more tutorial videos and learning and educating on our GAP plans.